Nearly $1 billion. That is what Illinois Republicans are raising a red flag as to the expected cost of taxpayers covering the health care for undocumented migrants here in Illinois. Good morning, back at it. It's Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY. Springfield's News and Talk, and this is obviously a big story because that's a big dollar figure. $1 billion in estimated costs in the coming fiscal year. That's going to be covered by the state taxpayers. This is something that Republicans raised from a report out of HFS. We'll hear from those Republicans here in a moment. They held a news conference yesterday. But again, the headline here, lawmakers say $1 billion estimate for migrants puts a strain on Illinois' healthcare system. Now, outside of hosting the morning show, a lot of you realize I go over to the Illinois Statehouse and I cover what happens there. I talk to Republicans, I talk to Democrats, and we reached out to Omar Aquino, who is a leader in the Democratic Senate caucus, and I asked him about this program. And we've talked about this in the past when several years ago it was brought up during COVID, and you had the efforts of some in Chicago to allow for health care coverage for senior citizens in this country undocumented, and in Illinois undocumented, and they can get health care. And then they expanded that. Now, I talked to Omar Aquino, Democratic state senator from the Chicagoland area, and he kind of gave an overview of the program and ultimately its genesis and where it came from.
The state of Illinois has been a trendsetter, I would say, in an example of providing health care coverage to all, no matter your immigration status or whatnot. And so we started with all kids, including children, that no matter what status they may be or their families have. And so we started with that. A few years ago, at the beginning of the pandemic, when we saw that, our communities, specifically communities of color, immigrant communities especially, were hardest hit, we reacted towards that and were able to be the first state in the nation to provide health care coverage, Medicaid coverage, to undocumented seniors. And then we expanded that to 55-year-olds, 42-year-olds, because that is the part of the workforce here in the state of Illinois. What I know is that since then, 50,000 more people have health care coverage and quality health care and are able to access quality health care here in the state. And if anything we learned in this pandemic is that my neighbor's health is going to impact my health, my family's health. We live in a society where, public transportation, public schools, wherever, you have folks from all different backgrounds. And so having health care coverage provided to all is something that should be, a goal for all of us. And, I want to remind folks that this is an initiative that was also supported by a coalition of organizations, including healthcare providers, namely the Illinois Hospital Association has been one of the biggest supporters of this initiative.
But again, this is an initiative that's costing taxpayers in Illinois only. And as we heard from Republicans yesterday at the Illinois Statehouse, there's an estimated $1 billion price tag for the coming fiscal year to pay for this. And typically with certain types of government subsidized health programs, state dollars can be matched with federal dollars. So it can be like a dollar for dollar match. So say there's a program out there that's to give qualified individuals, X coverage, the state will pay for half of that, and then the feds will put in half of that. And if it's a $200 million program for the state of Illinois, the feds will match $200 million, and then you really got a $400 million program, right? But this is different because these are undocumented Illinois residents. All right, they're here illegally. They either cross the border illegally, they overstayed their visa, whatever the case may be. They're here undocumented, i.e. illegal. So the federal government doesn't cover that. So when it comes to this program, expanding it to those who are here undocumented, state taxpayers are the ones covering that. And Republicans at the Illinois Statehouse took to a podium and they raised the alarm about what this is going to cost moving forward. And Noreen Hammond, a state representative, she lays out some of the major issues with this program.
The report recently released by HFS shows the initial cost overruns in FY21 related to the first expansion for seniors, specifically stating that, and I quote, in 2020, the healthcare benefits for immigrant seniors program HBIS, exceeded its appropriation in the first month of implementation. The initial cost overrun should have raised alarms with HFS, and the Pritzker administration should have shared this information with all of the members of the General Assembly. The HFS report shows that HFS and its contractual actuarial firm, Milliman, repeatedly underestimated actual enrollees and the costs. FY24 estimates now show growth in health care benefit coverage for eligible undocumented immigrants totaling 108,400 individuals over the original FY23 estimates, and enrollees totaling 31,500 individuals over the original FY23 estimates, a 202,000 and 94% increase, respectively. Much higher participation of undocumented immigrants in the health benefits expansion is only part of the miscalculation leading to increased costs within the program. The HFS report states, and again I quote, "Actual claims experience reflects higher enrollee costs than the traditional Medicaid population due to more untreated chronic conditions and higher hospital costs." The report indicates that Milliman believes the estimate for expanded health benefits for undocumented immigrant adults will total nearly $222 million in FY23 and nearly $990 million in FY24.
That's nearly $1 billion in the coming fiscal year that the Republicans are saying a new report out from HFS estimates it's going to cost Illinois taxpayers to cover the health care costs under this program that Democrats at the statehouse initially passed several years ago, expanded it another year, and here we are now with the possibility it's going to cost $1 billion in fiscal year 2024, which starts July 1st in Illinois. What that means, they're saying it's going to take money away from other much-needed services because we're not getting federal matching funds for the state dollars that are going to be used. So no federal taxpayer dollars are going to go to this program. It's only state taxpayer dollars for those of you who are paying income taxes and other taxes in the state of Illinois. And that's a problem because there's a lot of other needs out there that Republicans say needs to be addressed. Well, hear what Omar Aquino, Democratic state senator, has to say in response to that question of this $1 billion price estimate. So stay tuned. That's next here on WMA. Talking about $1 billion in estimated costs that Illinois taxpayers could be on the hook for paying for undocumented migrants' health care in the state of Illinois, not with matching tax dollars from the federal government. State Representative Ryan Spain reacting to this as well, especially with hospital groups asking the state for increases in what they get from the state. And here's what he had to say to that question. Well, let's get to it. Go.
I think your mention of the match is the most important. We have to be sensitive in everything we do within the healthcare space to maximize matching funds from the federal government. I was very happy to meet with some representatives of federally qualified health centers yesterday, FQHCs, and in fact met with one who has a particular focus on seasonal migrant workers. Now, those are workers that are here under a visa program, and they are eligible for matching federal dollars. And so I think it's important that we understand there are ways in which we can deliver important services. And
by matching federal tax dollars, but the program they're raising a red flag about doesn't do that. It's more open-ended and just puts Illinois taxpayers on the hook. Omar Aquino, Democratic state senator, he reacted to that concern, especially the $1 billion price tag.
So I know that HFS is looking to make sure that at every avenue that we can get matching funds from the federal government in terms of Medicaid review, I sit sit on the Medicaid work group. I'm well aware of those things. I do think that, look, we have our GRF that we our budget is a moral document that it's to figure out what we put dollars towards, and so providing everyone with health care coverage, I think, is a noble thing to certainly be a part of the conversation for our budget. What I would say is that some of the numbers, I think that proponents and like myself and the coalition, Healthy Illinois and others, sort of dispute some of the numbers that HFS has had. They underestimated in the first years what the senior population that would be eligible for this program would be. Now they're overestimating a significant amount. So I think that, in terms of reacting to numbers that we're not quite certain that are accurate is a little premature.
So obviously there's a lot more to be said about this, especially as lawmakers move forward in crafting a budget for the coming fiscal year that begins July 1st, and how much of this billion-dollar estimate is going to be taking chunks out of the $50 billion estimated budget. Stay tuned.
From the Fly SPI studio.